Semen morphology, or the shape and structure of sperm, can be affected by a variety of factors, including lifestyle, environmental exposure, health conditions, and genetic factors. Here are some common reasons that can lead to abnormal sperm morphology. 1. Lifestyle factors. Smoking, chemicals in tobacco can damage sperm, affecting their shape and function. Alcohol consumption. Excessive alcohol intake can impair sperm production and quality. Poor diet. Lack of essential nutrients like zinc, selenium, and vitamins C and E can affect sperm health. Drug use. Recreational drugs, particularly anabolic steroids, marijuana, and cocaine, are linked to poor sperm morphology. Obesity. Obesity is associated with hormonal imbalances and oxidative stress, which can impair sperm quality. 2. Environmental factors. Exposure to chemicals. Certain chemicals like pesticides, heavy metals, and industrial chemicals have been shown to harm sperm production and structure. Radiation. Exposure to high levels of radiation, including those from medical treatments or environmental sources, can damage sperm DNA and morphology. Heat. Prolonged exposure to high temperatures, for example, hot tubs, saunas, or heated car seats, can negatively impact sperm shape by altering the testicular environment. 3. Health conditions. Infections. Sexually transmitted infections like chlamydia and gonorrhea or other infections such as mumps can affect the reproductive tract and sperm quality. Varicocele. A varicocele, which is an enlarged vein in the scrotum, can impair sperm production and quality by increasing testicular temperature. Hormonal imbalances. Imbalances in hormones like testosterone, luteinizing hormone, or follicle-stimulating hormone can affect sperm development. Diabetes. Poorly controlled diabetes has been associated with increased DNA fragmentation and abnormal morphology in sperm. Genetic and age-related factors play a significant role in sperm morphology. Certain genetic conditions like Klinefelter syndrome or Y chromosome microdeletions can result in poor sperm morphology. As men age, sperm quality can decline, with an increased likelihood of abnormal shapes and decreased motility. Oxidative stress occurs when there's an imbalance between free radicals and antioxidants in the body. It can damage sperm cells, leading to abnormal shapes and DNA fragmentation. Medications and treatments can also impact sperm quality. Chemotherapy and radiation therapy, which are treatments for cancer, can significantly affect sperm production and morphology. Additionally, certain medications, such as those for high blood pressure, antifungal treatments, and antibiotics, can have a temporary or lasting effect on sperm quality. If semen morphology is a concern, lifestyle changes, managing health conditions, and consulting a healthcare provider are often recommended.